I ran across this video saying that 80% of US health organizations are using AI. So let's watch this video and see how they're integrating it in the healthcare system right now and how it's helping or making a difference for us.
This morning on today's checklist, a look at how artificial intelligence is shaping the medical industry. Nearly 80% of U.S. healthcare organizations are already using AI, according to a recent report. So we're here to break it down, how it shapes our experiences as patients, as board-certified colorectal and general.
80% that's a high number. That's a very high number. And I feel like this video is almost 8 months old. So I'm sure that number has excelled since then.
Surgeon Dr. Cedric McFadden. Good morning, Doctor.
Good morning, Dylan.
So AI in the medical space, what does that look like?
Well, so Dylan, I grew up watching the Jetsons. And so in many ways, stepping into healthcare right now is like stepping into that future world where we're able to solve these really complex problems with just incredible efficiency. In rural areas, for example, local clinics, they're using AI-driven tools to help diagnose patients remotely. That means that patients are connecting with specialists without even needing to leave their community. That's a game changer. For many of us, another example, at some point you
I don't know about that one. Isn't that sort of similar to like a Zoom call or something along those lines? Having to leave the house. I think he should have went a little bit more in detail explaining what that is. Or are they consulting with the AI itself? Is that what he's saying?
had to go to the emergency room, right? And what's the one dreaded thing about the emergency room is the wait. No one wants to wait. So hospitals are using AI to help predict the times that those hospitals, ERs, are busiest. So they have enough nurses, they have enough techs to take care of you so you're waiting less. Also, when we
Which I'm sure they was already able to predict the busiest times if they kept any type of analytics. But I guess this will make it a lot more accurate in the situation.
create new medications, new therapies. They're using AI to help determine what types of conditions, what genetic makeups are going to be best served with those.
Now, that's something that I feel like is groundbreaking, right? New medicines and being able to find conditions that they weren't able to in the beginning without this technology.
Medications. It's really about getting faster access for patients to breakthrough therapies.
Doc, in what other ways has AI helped, transform patient access to care?
Well, you're likely using AI now and you don't even know it. If you've scheduled a doctor's appointment, if you've done a telemedicine visit, or even if you just inquired about a non-urgent health need, you've likely used an AI-based tool. Many of us are wearing these wearable devices that track our steps, check our, absolutely, check our steps, our heart rate, and they give us real-time personalized feedback into things we can do different the next day. And here's what's interesting. The feedback that you get is very different than the feedback I get. And that's really how AI is being used. If you're taking multiple medications, this is really important because you should try one of these apps potentially to help you manage when to take those medications, what are the interactions.
And the big importance I see from that is being able to express to your doctor what's really going on, because without trying, you're keeping a record of what's actually happening in life, right? You don't have to pay attention to how many steps, how many calories, your heart rate throughout the day, when you're the most stressed, how long you're sleeping at night, and all these things that take a lot of effort away from doing that. And then once it comes time for that checkup or going to go see your doctor, you can give them a more accurate answer to the questions that they have. And you also are learning yourself in that process, because I'm sure a lot of people don't really take the time to keep up with those things because a lot of people deal with everyday life.
Actions of those medications that you take, and it really can make a big difference. There's so many apps you can use. If you have dizziness, you can just say, I have dizziness. It's going to tell you what are the causes of that dizziness. It may tell you what questions to ask your doctor, what are the red flags, and all the other things that you may not get from just searching a regular search bot.
So you go to these search bots or chat bots, and you're interacting with them. What information should you avoid inputting into that chat?
Yeah, so that is, I think, probably one of the best questions right here, because, it's important to remember that AI is not HIPAA compliant. Right.
Oh,
so when you come to see me, I have not only a moral and a professional obligation, but I have a legal obligation to protect your privacy. AI is not. So you really want to be careful about giving your full medical history, your full history of medication, because there can be inferences about your health that you may not want people to know. Also,
and maybe he's about to say this part. He's talking about the privacy of giving all your information to a chatbot. But one thing I've seen is misinformation or hallucinations from AI chatbots, and they're not actually knowing everything, right? A lot of times you have to go and double check these things and do your own research before just going with what you're told. So I wonder if they're using different types, or are they using the same program chatbots as ChatGPT, Grok, and all these other chatbots that's on the market right now? Because I would expect them to have a more, especially in the medical field, the healthcare field, I would expect them to have a more educated chatbot based around the industry that they're in, and not just a generic one that everyone uses for multiple reasons.
you want to avoid putting like your social security number, your medical record numbers and things. And just remember that AI is not replacing your doctor. It's just another tool in the toolbox he's going to use or she's going to use to help take care of you.
My takeaway is AI is not HIPAA compliant.
It's not HIPAA compliant.
Not HIPAA compliant.
Yes.
So now let's look into the future.
Yeah.
Where do you see AI going?
Oh, the trajectory is amazing. The vast amount of data that AI can take in, they're diagnosing conditions like cancer and Alzheimer's even before symptoms are present, years in advance. So they're looking at biopsy, pathology reports, looking at CT scans, MRI.
Now that's major. That's major. I don't know how many stories I've heard of people saying, "Oh, I went to the doctor. They told me nothing was wrong," and then years later, some type of horrible cancer or disease pops up, and now they're late in the process, and they got to go through this extensive healing or just a mass amount of medicines. So the fact that AI is able to catch on to these things before symptoms even show, that's groundbreaking, right? That's something that I feel like is really going to change the healthcare field. That's something that I wanted to hear in this video. Not necessarily being able to set appointments or know how long it's going to be of a wait time and all of those things. Yes, that helps them run things smoother, but let's talk about actual caring for the health of people, right?
And giving you faster input so that you can start treatment, because the faster you get this information, the better your outputs are. Surgical advancements, I do robotic surgery, and patients walk in, they say, "Hey, are you going to do this robotically?" So they've been expecting it, right? Because they know that smaller incisions, quicker return of their normal life, it's really important for them. And so it's not taking advance, it's not working independently of your doctor. It's a part of what they use. And I think finally, more virtual care as our population expands, as we have the question about, do we have enough doctors to take care of this, is going to be key. And I think the important key here is to make sure that it's equitable, right? That people have access to it. What's the cost going to be? All those questions. And we have to put these safeguards in place. But, I'm living the Jetsons every day with in healthcare. It's amazing
Always
stuff.
comes back to the Jetsons.
It's a lot less scary now when I hear you put it that way.
It's a part of what we have already. Embrace it. Make it work with the safeguards.
Unless you get stuck on that treadmill, and then it's really bad.
Thank you, guys.
Thank you so much. Thank you.
Hey, thanks for watching.
Yeah, I think this was a good clip to watch, a good video to watch to help us understand how AI is transforming the healthcare field, and in what ways we can trust it and what we can expect from doctors using it. I like the fact that they only see it as a tool and not trying to replace the work that they do to make things less of a load on the work that they need to do. So I really like this one. I think this was a good one to watch with a good amount of information in it.